Alright, let's dive into something that's been making waves lately: the Senate's confirmation of Dr. Erica Schwartz as the new director of the CDC. Now, on the surface, this might seem like just another bureaucratic appointment, but personally, I think this is a moment that could shape the future of public health in the US in some pretty significant ways. What makes this really interesting is the context. Dr. Schwartz is stepping into a role that's been vacant for nearly a year, and she's inheriting a laundry list of challenges, from a measles crisis to rising vaccine hesitancy. But let's not get ahead of ourselves. First off, the timing here is crucial. The CDC hasn't had a permanent director since August 2025, and that's no small detail. In my opinion, the lack of stable leadership at such a critical agency during a time of public health crises is a red flag. It's like trying to navigate a storm without a captain. Things can get chaotic fast. And while Dr. Schwartz has impressive credentials, including her time as Deputy Surgeon General and her military background, the real question is, can she steer the ship through these turbulent waters? One thing that immediately stands out is the political backdrop of her appointment. Dr. Schwartz served under the Trump administration, and while that's not inherently a problem, it does raise questions about her stance on certain policies, especially those pushed by Health Secretary Robert F. Kennedy Jr. Kennedy, as many of you know, has been a controversial figure in public health, particularly around vaccines. What many people don't realize is that his policies and rhetoric have been linked to rising vaccine hesitancy, which is now a major issue Dr. Schwartz will have to tackle. So, the big question here is, will she be able to distance herself from Kennedy's more contentious stances? Or will she toe the line? Her Senate hearing last month didn't exactly clear things up. Personally, I found it a bit concerning that she dodged questions about whether she'd challenge Kennedy if he tried to undermine science. I mean, as CDC director, your job is to protect public health, not play politics. Senator Bill Cassidy, who's a doctor himself, called her out on this, saying we need a director who'll stand up to crazy, stupid things that erode trust in vaccines. And while Cassidy eventually backed her nomination, it was only after private conversations and assurances. That, to me, suggests there's still some uncertainty about where she stands. What this really suggests is that Dr. Schwartz is walking a tightrope. On one hand, she's got to prove she's independent and science-driven. On the other, she's operating in a highly politicized environment where even the CDC's own web pages have been altered to cast doubt on vaccine safety. For example, the recent change to the CDC's Autism and Vaccines page, which now says studies haven't ruled out a link, is a glaring example of how politics can infiltrate public health messaging. If you take a step back and think about it, this isn't just about one web page, it's about the integrity of the entire agency. From my perspective, the real test for Dr. Schwartz will be how she handles the measles crisis and the cyclosporiasis outbreak. These aren't just numbers on a chart, they're real people getting sick, and the CDC's response will be under a microscope. But beyond that, I think her biggest challenge will be rebuilding trust. Trust in vaccines, trust in the CDC, and trust in science itself. And that's no small feat, especially when you consider the damage that's been done in recent years. What makes this even more fascinating is the reaction from public health experts. The National Public Health Coalition, for instance, refused to support her nomination, saying she didn't commit strongly enough to protecting CDC guidance from political pressure. Now, I'm not here to take sides, but I do think their concerns are valid. If the CDC director can't or won't stand up to political interference, what does that mean for the agency's future? This raises a deeper question: can any director truly be effective in this current political climate? Personally, I'm cautiously optimistic about Dr. Schwartz. Her background in the military and public service suggests she's no pushover, and her commitment to evidence-based guidance is a good sign. But the proof will be in the pudding. Will she push back against policies that undermine public health? Will she prioritize science over politics, even when it's inconvenient? Those are the questions I'll be watching for. As we wrap up, I want to leave you with this thought: the CDC director's role isn't just about managing outbreaks or approving vaccines, it's about safeguarding the public's trust in science and institutions. And in a time when that trust is more fragile than ever, Dr. Schwartz has her work cut out for her. So, here's my question to you: what do you think it will take for her to succeed? And more importantly, what does her appointment mean for the future of public health in the US? Let me know in the comments. I'm really curious to hear your thoughts.